Welcome to another episode of the Zelos podcast. I'm your host, Rocky Snyder. This week, Dr. Jena Gatses is in the house with me. She'll be speaking at the Perform Better Functional Summit in Long Beach in the middle of July. Just go to performbetter.com. A whole bunch of amazing presenters going to be there. Great networking opportunity and education. Speaking of education, Perform Better at the end of September at their Functional Institute at their headquarters in West Warwick, Rhode Island. I'll be teaching a course on a one-day workshop about recalibrating movement from the ground up, getting to know how your feet affect the body and vice versa. If you can't make it there, you just want to get some more continuing education, then head to my website, rockysnyder.com, because I've got online and in-person workshops available, blogs, podcast archives, and more. Don't forget this July 16th to the 17th, or 19th, I should say, the NSCA National Conference is happening in Kansas City, Missouri, so make sure you go to nsca.com and register today. Satanta College is the place to go for your Masters of Science in Performance Coaching, from applied biomechanics, sports injury, and return to performance management. They've got programs to meet your needs. Just add RS10 at the checkout for 10% off tuition today. Very affordable way to get your Masters. Be sure to follow us on Instagram at Rocky_Snyder. Click the subscribe button. Let's get on with the show. Jena, first of all, this was so cool that we got back together, not just for this podcast, but last weekend in Chicago, hanging out at Perform Better, you and your little dog just taking up some good, positive space. Love hanging out with you. So I get a chance to do it again just on the airwaves. So thanks for coming on. First of all, what were you doing in Chicago? Because were you presenting? I was so busy with other things that if you did, I apologize for not seeing your presentation.
No, I spoke at Chicago last year, but this year I'm speaking in Long Beach. So I was supposed to have my niece's baptism on Sunday, and I'm like, hey, what are the chances that it worked out on the same weekend? So I'm like, I have to go and support Perform Better, and just, I love listening to everyone speak. I love seeing the fresh education and the fresh knowledge that everyone's, just giving out and spending their time and their hard hours just reading and researching to get this and try to give us their fun facts. That's the best part of Perform Better, is like you get everyone's fun facts. People like Greg Cook, that, he's been an inspiration for me my whole life. And, now we're friends, and it's surreal, but it's amazing because talking to him, we're both like little nerds and just going back and forth with ideas. We were just talking about that safe space where you feel comfortable just talking about ideas. And, as humans, we don't know a lot about science. We don't know everything. Nothing's conclusive. So let's always be open to exploring new ideas and, checking ourselves and keeping ourselves in check sometimes.
Yeah, I got to say, it was nice not being a presenter and just being an attendee, because not that there's a lot of pressure, but it's just that there's a lightness, and you're like, oh my God, I get to hang out with my friends and co-presenters and meet new people. And the nice thing about it was there were so many new faces, first timers. It had to be like half of the 600 plus people that showed up were new to the industry, which is really refreshing. So I'm sure you're going to have that next month, yeah, in Long Beach. So that's going to be July 16th, 17th, right around there. And you're
Yes.
presenting there. I got to apologize ahead of time. I'm not going to be able to attend Long Beach. I'll be at the NSCA National Conference there. But tell us all, what are you going to be? What's your presentation? What's the title and what you're going to be talking about?
No, it's no worries ever. I always tell everyone, people are busy. There's things going on. I feel we're all meant to be where we're supposed to be, and never add stress. We have enough stressors in our lives that if you can make it, you can. If not, we'll see you next time. You're always doing something cool and passionate, and I love that. So I would love to come to the NSCA event too. So maybe next year they won't align on the same weekend. But my topic is basically talking about recovery and understanding the physiology behind recovery and what it actually is and what you're doing, and not just looking at everything as an individualized piece, but looking at it as a way that how it impacts the system as a whole. And people have that disconnect because our system is so, isolated in groups. There's specialists for this or specialists for that. Not everyone communicates, and it's not always, conclusive across professions. And, these are people we're dealing with, and it's people's health. So I think it's important, we took that oath, and, as trainers, therapists, everything, we want to do no harm, and we care about human beings. So I think it's important to understand what we're doing and try to educate people as much as possible so they choose the things that are right for them, and you make people autonomous with their own health, and it's a beautiful thing to watch people become independent and become strong behind their health.
So, with your background and the clientele that you have now, background being NASCAR and one of the first, if not the first, female strength conditioning and guru in the race scene there, but now you've got a very exclusive, high end clientele in the Los Angeles slash Hollywood area. Give me a little compare and contrast between the two.
So I love it. The thing is, I've always worked with extreme injuries also. So I always wanted to see how can I take the body from a state of injury to a state of performance. And, being injured my youngin ages or, in my younger years where I thought I was invincible and I thought everything I was doing was correct, realizing that I wasn't doing things right. I got some injuries. I wasn't eating healthy. I would run and, only eat tuna and chicken and broccoli. And, I thought you had to do these certain things in order to be skinny. And then I stopped caring about being skinny. I started learning a lot about physical therapy and just stabilize their muscles. And I started becoming a personal trainer. I did massage, but I had my hands-on stuff early in my career, and I studied exercise science. So I did all that, and it helped me help people that couldn't find help in other places. So I had a guy that was paralyzed one time, and he's no longer paralyzed. He was paralyzed for 10 years. And I was like, well, we can't mess it up more. And he just started laughing, and it was like, this is, I can't believe you treat me like a human. And that right there, that broke his crutch. And so his nervous system was able to get past. And I was like, whatever, it doesn't work. I'm like, just pretend you're sending energy down there, just visualize, because visualization was big. In NASCAR, there's a lot of guys in NASCAR that are ex-NFL, but there's also farmer boys. But we would go on different trips to different places like the Navy SEALs. So we would look at their training and recovery, and they were doing things like the meditation pods and the float tanks and things like that, where you're getting in the intricacies of how the body is working and what you're doing and what factors play a role in someone's recovery, their physiology, and their homeostasis. Because if you're not returning back to homeostasis, you're never going to go to the point where you're going to go beyond that and be able to control anything. It's just a state of chaos at all times. So after 6 months of working with that guy, we did a bunch of different things, proprioception and balance. We did the vibration platform. And he was like, I felt my toes move for the first time since 2001, and it was 2011. And he had complete foot drop bilaterally. He only had hip flexion. So he had braces. He was in a wheelchair. He had braces around his ankles because his feet would literally drag on the floor. And he was a fall hazard. And so I would try to knock him over. Like, we would play games, and he doesn't wear braces anymore. He wears regular gym shoes, no longer has drop foot.
Phenomenal.
So when you're doing things like that, where you're not hurting anyone, but you're exploring the education that we have, like, well, let's take this further, in a system of let's just fix and band-aid stick. I've really explored things outside of that. So I've been helping extreme injuries since before grad school, when I was in undergrad. And I was working with a lot of pro athletes before even going to grad school. So when I went to grad school, all my clinical rotations were in things like the ICU, the burn and trauma center. Like, I wanted to see what I didn't know to make sure this is what I wanted to do. And skilled nursing facility, wound care. I've seen some things, but everything is for a reason. And I'm so thankful for all of it, because then I came out with a different perspective, instead of, I'm like, well, that impacts that. And no one's even looking at these things. It's either you're a specialist in this or you're a specialist in that. So, NASCAR, it's a lot of the same things, because some of those guys are really sedentary. I had Joe Gibbs' son. He was like, I put dip in to stretch. And I was like, that doesn't make sense. So I'm like, because I was having the guys do yoga. I finally got the guys in charge, and I'm bored with everything, because my results speak for themselves. So you start to feel better. It doesn't take as long to warm up to things. You're not working against everything every single day. If you're foam rolling every single day, there's something wrong. You shouldn't have to foam roll to do life. Like, you should be balanced enough where you're not always in spasm. And so that's where I really coordinate people, get them out of the acute phase. And then I take it to where they're never hurt again. Like, some of these celebrities, these CEOs, they were little dainty things. They turn their neck and strain for 2 weeks. They can't move, and everyone's changing their schedules around. And now, like, I have a guy, he's a mountain biker. He's 57, but he goes with the pros. He works with all the pros because he's a guy from Sony. And they're like, he just falls and just gets back up and he's fine. So you can make the body resilient no matter what age. No, I have a 95-year-old. It doesn't matter. We had our
Yeah.
hearing coming back.
Yeah. Plasticity is not age dependent.
No, it's if you stimulate it or not. And so if you're not stimulating it, use it or lose it's real, because it will literally go away. It's a reflex loop that your brain's like, oh, disregard, because we don't send energy there. So it's pretty crazy.
Yeah, it is. So I'm thinking of like a Snap-on tool, big toolbox on wheels, red and black, as to where you put all the knowledge and experience you've accumulated. We could use that as an analogy. I mean, you're SFMA, you are doctor of physical therapy, you're licensed massage therapist, you're certified strength conditioning specialist, and you've got basically more than an alphabet behind your name because you pursue knowledge, you're inquiring about it, and I haven't even talked about diaphragmatic breathing, neurology, nutrition, hormonal balancing, blood testing, and so on. Like, these are all in the drawers of your toolbox. Now, there are some common tools that you will reach for, most likely, just like somebody will need a wrench and a hammer. But every now and then, you need a torque wrench. You need some kind of special long Allen wrench. You need a coping saw, whatever it is. All of these ones that I would say that are in your toolbox, it can become quite overwhelming,
Yeah.
Jenna, can it? I mean, so the question is this, because I've got my own alphabet of a whole bunch of things too. And I kind of rely, I don't want to say instinct, I rely on the unconscious mind providing me guidance as to what I'm seeing with people and what their
Mhm.
body is reflecting, how they're moving, and so on, to guide me into the tools I need to use with the clients that I'm or athletes that I'm working with. How do you how do you navigate that yourself with all of the things that you could do with the limited time you have?
So, and that's the thing, is it is limited, and I'm one-on-one. I don't take insurance, and so I'm out of network. I don't let insurance dictate what I do. So I'm very unique, and no one really understands what I do. And I'm like, it's overwhelming for the patient in the beginning because we're building neural pathways and stimulating neural pathways that haven't been stimulated. And the brain wants to always be comfortable. We're just animals that want to be comfortable. So I'm working against such a resistance. And like, it's so funny in the beginning because I'm working with, and it's important to have these tools because I'm working with kids. I'm working with people that have a disability. I'm working with, people that are in jail. There's CEOs flying in from other countries. It's crazy. Like pro athletes, yeah, that's easy. At least it's, I stick to one sport and they move. I know exactly how they move. I can look up the sport, but it's the same body. So I just think about, what does that body need in that moment? And these tools, it's like sharpening my sword, and I become more precise. And it's not me. I'm shown just like intuition that you have, and us being givers. And I know you really well, where we don't trust our intuition enough because we're guided in a way where, like, people are like, how do you even see that? Like, I'll cue and they move and I'm like, oh, nice job. They're like, how did you see that? I'm like, how did you not see that? So it's just, you can tell how the bones move. You've been doing this, and that's why your education is so important. But the intuition and getting outside of that education, because that's also all facilitated. We were put in a curriculum. The research is paid for. Sometimes it's accurate, sometimes it's biased. So it's always good to look at other sources and bring everything in together. And I really feel like, with the amount of patients and the array of patients that I have, age range, whatever, gender, everything, sports, and the wear and tear on their bodies, and it's the psychology that requires me to have as many tools as possible. Because in the beginning, there's so much resistance. You're not going to want to do it. You're going to have every excuse. Oh, this agent said this guy said this, I'm doing this with this guy. I don't care. I got to the point now where I don't care. I'll shut you up right there and then. I've been doing this for too long. I see it too many times. Hundreds of thousands of people I've been doing this with. I don't care. I feel like I came out to LA after NASCAR. I was with them for 4 years. I have championship rings, 3 championship rings under them as head coach. So I built their whole recovery center. We had contrast baths and everything. So it's what tool can I use with this person and get the furthest without being a detriment to their health. So, whether it's psychological, some people, they think I hurt them. I do the same thing in a different position and they don't know what's happening and they're fine. They're like, oh, see, I told you that was better. I was like, yeah. They're like, you just put me, it was the same way, wasn't it? I was like, yes, I manipulated you for your own good. And so like, I'm very honest with people and I will always tell the truth. And if I don't know something, they know I'll go research it or I'll find a specialist. With my podcast too, Enhancing the Human, like finding these people that, I found a ozone practitioner that has seen where he's cured cancer. He's talked about curing HIV, educational purposes only. He's talked about where people, test positive for HIV, come to him, have one treatment of ozone, one treatment, and they no longer test positive for HIV. So there's things like that where, again, our education, our research is out there, but there's things that we don't know as humans, we're just human. And people, like we were talking about with the ego and psychology, we have to keep ourselves in check and not be greedy and not let greed run our lives, because that's when we start to do things for the wrong motives. And then who knows where we're going as a society. So we have to always be curious, always lead with integrity as much as possible, as much as we can, and just keep moving forward and trying to better ourselves as human beings. We're one of the most unhealthy countries in the world.
Do you have a time frame when working with an individual client or patient? Like, do you section off 1 or 2 hours, hour and a half, 30 minutes? What is it like?
So if it was, I work with a lot of billionaires, and if it's a world where money is not an option, I have protocols where in the beginning we have to do a lot of, the only reason why you need soft tissue work is because your body is uncoordinated and you can't handle the forces coming at your life. So we get to, we go from like, I see you a lot in the beginning, maybe a few hours a week, to as far as for soft tissue and different tools, vibration, all these different tools. And then we get to the point where you no longer need soft tissue as much because you're so coordinated, your body does not revert down to spasm. So it's just trying to protect itself. So it spasms back down. And then you're in this state of fight or flight all day with your stressors coming at you from work and from your job or whatever sport. So it's all about getting the person healthy without taking them completely out of their life. As far as, repeat the question that you said, I forgot what you asked.
Well, just like, what's the length of your sessions typically with a
Oh,
person?
they're an hour normally, but say I have a CEO, sometimes I'll fly with people where we'll have like the workout in the morning and we'll do coordination in the morning, and it's exhausting. So we could do some breath work stuff in the midday. It just depends on what they need and what their time allows them. And so, but usually I could do anywhere from 3 times a day to 3 times a week. Or if it's a money issue or you want to be more autonomous, I'll give you an at-home program. I can watch your assessment on video and tell you what you need and give you some guidance through your movement. So I have NFL guys that are like, you tell me more on Zoom than my coaches can in real life. And I work with, like, it's pretty crazy, but you probably see it too, because you care. So you go that extra mile, and you've gone a lot of extra miles over the years, it kind of adds up. So it's really, I'm blessed. I really feel that.
It definitely does. And there was a time where through the middle of my career that I was unconsciously putting the outcome of my clients on my own shoulders, and taking on their issues, like just feeling like yeah, for whatever reason. So that, I guess, is the next thing. It's like, how do you protect yourself from burnout? How do you protect yourself from, because you've got, we're both kind of East Coast edgy. We've got that nice kind of, hey, this is how it is, shut the hell up kind of thing. But
Mm-hmm.
truly though, being a caregiver, how do you take care of yourself? How do you become a caretaker?
So, just like any giver, you get to the point where you break and I'm like, I can't do it anymore. And so my last facility, I had my facility and my clinic was commercial on the bottom of the building, and then they had residential on top. And so the whole building was toxified with black mold, Stachybotrys and Aspergillus. So I was
Oh,
in it for like 3 years, and elevated
oh,
elevated mold spores were 1,500. Mine was 997,000 spores. So it was, and I knew something was wrong. I couldn't remember things. I lost all my hair. So if you remember, I used to have long hair. So a lot of things happened where my health was deteriorating, and I realized I was working 12-hour days, at least 6 to 7 days a week. And I just remember, like, no one's going to care about me if I don't care about me, you know? So, and then the landlord sued me. There were a lot of things that were happening that were to try to scare me. And so it's crazy out here in LA. It's like the Wild Wild West, but it's school on steroids. Lots of school. I'm learning. I'm like
Wow.
a lawyer. So yeah, it's on a small scale, on that kind of scale, I finally started, drinking my own Kool-Aid. Before I'd go in and negotiate with these people that are, the most famous celebrities in the world, I sit outside and I do breath work. I get myself and I regulate my system. I try to exhale, do some box breathing. If I'm panicking before I go in there, I'm like, oh, I feel like I'm in the TV. It's crazy. There's so many different stimuli coming at me at that time. And plus, being a woman in this, like, and I seem younger than I am, because I try to make people feel comfortable. And so there's a lot of variables where someone's perception is based on what they know, so they can perceive things that are not really there. So I always have to, be ready. And I feel like communication and exploring communication has been the best thing with that, because I can still lead with love and put boundaries up in a loving way. Before, I didn't know what was happening, and I would try to do tactics and they would still step over my boundaries. And I'm like, what the hell is happening? But then I was like, I really started respecting myself more and giving myself the love I give to everyone else. And it's crazy. It took the mold, and I got a brain cyst within that whole thing. It was a 16 millimeter brain cyst. And so I'm like, all right, I had to be forced. I wouldn't have done it any other time anyways. So I started doing detox stuff and really like diving deep into my own health, and doing coffee enemas. And you really find some interesting knowledge when you dive deep. And it's interesting what you can do to help yourself in your health naturally. And it's just, little side things. So I work with the best in the world, and I cross reference everything, and I talk to different specialists. And it's really cool what things you can do to contribute to your health, to the point where, like, even when things are thrown at me, I don't crumble, because I've been here before. You know what I mean? Like, my system is regulated. I'm recovered in life. So things that stress other people don't stress me anymore, because I'm conditioned. My system's conditioned. So, that's what I look at life as, is not only trying to regulate and balance my life, but also teach people how to regulate and balance theirs. Because it turns into relationship problems or injuries, or, jobs are ruined because of issues. So it's all the same stuff.
Yeah, it is. You can't separate it. It's all interconnected. Whether we're talking mental, emotional, spiritual, physical, I mean, it's all one. So, are you completely recovered from the mold invasion, or where are you with that?
So I looked into fasting too, getting rid of cysts. I don't want to have brain surgery. So I basically started looking at cysts and how I can get rid of cysts. And I found biofeedback. I started doing dry needling where they hook up different frequencies to the tissues and things. So basically, my system was so unregulated and like toxic before, eating Starbucks freaking breakfast sandwiches in the morning, because it's like I didn't care about me because I had so much to do, that I'm
I
like,
hear you.
anything is going to be better than what I was doing. So I'm going to detox and do things the right way, and give myself, like I said, the love. I'm doing PEMF, hyperbaric chamber, even just basic things. You don't need all that fancy stuff, but just setting apart some time from my day to work on things for me, and using equipment that a Perform Better has too, just saving lives with my foam rollers and my Theracanes.
Right on. Okay. Sincerely, that's just wonderful. You mentioned in regards to like movement or the body, things need to be activated. If they're not active, they're not activated, they're not stimulated. And therefore, the connection to the nervous system is very low, if not really almost non existent. And
Yes.
so, and I know you're going to agree, but I'm going to put it out there anyway. When I'm watching somebody, whatever kind of screening assessment in regards to dynamic movement, or for that matter, even a static posture assessment, I struggle to observe the elements of movement that I struggle with in my own body. So, because it's not being stimulated and therefore I don't have any connection. And if I don't have a neurological connection, how am I going to observe something that I'm not connected to? Right?
Right.
Do you find that the same?
Well, so that's the thing is like I've explored every single angle of that. So not only do I have to be able to stimulate something, I have to be able to work with someone's ego to allow them to put me in a position that they feel vulnerable and they're still going to let me and breathe. Because if you're not breathing, you're not going to stimulate it. And then also, if they're scared of that position, I have to modify it. And then I eventually have to get them to their function. So I would have EMS guys where they're EMTs, EMS, like they're going in these weird places, lifting these dead weight people. So it's like you get the person to the point where they can be active in any situation. So I have to be that good. And the reason I am that good is because when I was a personal trainer and I was going to school for exercise science, I worked at a bunch of physical therapy clinics and I was the PT tech that would do the exercises with the patient. And I would watch myself cheat. And I'd be like, oh, look at me. I'm just like leaning over because it's easier. And I'm like, if I go this way, it's harder. And then I'm like, oh, my patient's doing that too. So I'm like, oh, funny. And so like that over time. And then I went to massage school and I'm like, wow, when she presses on that refers to my knee, but I'm nowhere near my knee. And that relieved here. And so that every part of what I've ever been through has contributed to just my understanding of how to stimulate that. So I guess I'm like, I can stimulate anything on anyone, but I'm serious.
Seriously. So it sounds like, in a way, you're talking. If I could go with Gary Gray's language, the transformational zone or the oh shit zone. It's the place where you're butting up against the edge of your base of support. It's where the nervous system totally starts to kick in. It's the place where people don't like to go. They stay
Right.
in their comfort bubble and in their center. And is that what you're basically talking about? Putting people in precarious places and positions?
Well, the thing is, it doesn't matter what you do, like you were saying, like your nervous system, you look at it like an electrical circuit, like an electrical system. It's, power lines powering all these houses. Some of them, the lights are kind of on, the dim's really low, but it's basically dark because no one's home. So, but other ones are really, really bright. The ones that are bright, basically, it's a reflex loop. Like your body likes those. That's where the comfort comes from. It's a reflex loop. It's rate coding. How quickly can you respond to that muscle? How quickly, if your body knows it has to respond to a stimuli, how quickly can you get that nerve to stimulate that muscle? You can prime that. You can condition that to be better. So your body's like, hey, this one reflex loop of quads is really great and I'm just going to do everything with this, or my upper traps, or I'm going to throw my arm up sideways just so it goes on my neck versus having to go through my core. So it's basically teaching people foundational work on tapping into their breath, because their breath is the key to their core. Then I can transfer forces from their feet to the top of their body and put them in any position and condition them out of neutral. So I tell everyone, you have to master neutral. People are like, we didn't even move and I'm sweating. I'm like, I know. Or like, it's funny because you're working these new pathways and your body's like it doesn't want to do it. And so I'm the queen of that. And then I go back to that too. I have to plant a bunch of seeds because they're like, this isn't good. I don't think this is good for me. And I'm like, you're gonna cramp. They're like, how did you know that? So I have to there's a series of things psychologically in the beginning that I have to reinforce. And I say planting seeds, and then I'll refer back. Hey, remember when you hated me and you made fun of my exercises and you were so angry? And they're like, yeah, I hated you. And I was like, yeah, I hate you too. But we had to get past that uncomfortable phase, because now they're like, wow, that really made me feel good. But their body resists it. Their doctor tells them not to do it. Everyone's against what I'm saying, but I still have to get them there. So it's just, finding a way, like I said, communication's everything, because I work with so many different egos. So it's just trying to do the exercises we're already doing with a different body part, or in a different way, in a systematic way, not a compensatory way.
Yeah. Okay. So you just brought up the fact that there's like a neurological response, and not a threat response or a sympathetic response so much as just a neurological challenge. And one of many symptoms might be perspiration. Just they start sweating. Right. There's also tone color. You're going to see complexion changing. You're going to see emotional changes. Right. So those are
Their
really
heart rate goes
cool.
up.
The heart
They're not,
rate, right?
but they're not
There's
even moving. And so like you'll see
no.
these professional UFC guys and they're like, I don't understand. We didn't lift weights. And I'm like, I'm not going to do what you're good at. We're going to do something that's easy enough where I can make sure that your dominant patterns don't turn on. It has to be easy enough. And then that lasts for a couple weeks, depending on how intuitive the person is. And then you can start taking them out of neutral and getting them to where they're functioning and doing whatever they're lacking in their life that they want to work on as far as their function.
Jenna, I love that because it relates to something that uh, we continually look at, and that's volume of work. And I think historically, in the world of physical therapy and strength conditioning, they're both, I think, fall into this category that we automatically go with a 10 base number system, and we're saying, okay, how many reps and sets you're going to do, and we actually, when we're trying to stimulate an area that is not engaging, that is, it struggles to have a proper movement pattern, and we overly try and load into it with high volume or load, then
Mhm.
without knowing it, the practitioner, without observing it, is probably just reinforcing the dominant patterns, right? So um,
100%. That's what drives
it
me crazy
happens
is
all the
people like,
time.
oh, you're a physical therapist. I do. And I was like, I don't, I love physical therapy, but like the systemic way of doing physical therapy is here,
Yeah.
go do your exercises. The thing is, if they did their exercises correctly, they wouldn't be here in the first place. And so even when I was a tech, this was when I was, in my 20s. I remember I was so obsessive with what I felt and like what I was saying, how I was like, wow, I'm compensating. I could feel this more. My glutes not activating. I see my body cheating, and people would want to work with me over the therapist. I didn't even go to school yet. I had no education but my exercise science. I was getting the degree, but it's crazy because they're like, I've been coming here 6 months and I've never felt the exercise like I did with you. So that's the thing, is I became the crazy exercise person where like I can turn anything on. Like I could turn anything on. I'm around freaking happy
But
too
I
much.
know what you're saying. So here's it. So where I come from is basically we're going to do one repetition and see where we go from here. And then maybe we'll build up to two or three
Yep.
repetitions on specific things that we're actually trying to negotiate new patterns within the system that aren't going
You
to
don't
be
even need more than
tricked,
one.
right? If you do it in a
If you do
proper
it right,
way.
they'll start sweating, they'll start
Dude,
shaking, uncontrollable shaking. When you start exhaling and breathing while you're doing something, you start shaking. I call it baby giraffe. But that rep, I said that's a
baby
6 month
giraffe.
pro. Literally, it's all
I
like
love it.
it's so true though, right? Because, and I
Yeah.
say tap into that because, and it feels so weak in the beginning, but if there's something that feels good to the patient, they're like, wow, that feels good. I'm like, I know, just tap into that. But that one rep is equivalent to a 6 month program. So like they'll do that one time and I say that's it. They're like, well, we did this many on the other side. I'm like, you did the shit on the other side. So we're only going to do one on this side versus the other side we did three. But you don't, it's not about quantity over quality. Everything is quality. You're trying to become a ninja where you're hyper isolating everything and you're trying to gain back those degrees of freedom and degrees of motion at the joints, not just move as a block. Because we lose those as we age if we let
Yeah.
ourselves. We don't have to.
I love that you brought up the asymmetrical workload or just programming. And I think that that is something that this industry really needs to tap into more because there is this thought, well, what I do to one side, I've got to do the exact same to the other.
No.
But what if, neuromuscularly speaking, in terms of pattern, you already know intrinsically that your right leg serves a completely different purpose than your left leg, just like being dominant in your hands. Like there
Yes.
are certain patterns. Try brushing your teeth with the opposite hand tonight, and you'll very fast, rapidly discover that you don't have the same patterning. And so to assume that we're going to have to do the exact same on each just seems ridiculous to me. I
Yes.
I don't have a problem with just actually loading one leg and just say, you know what, we're not going to even focus on the other leg for right now because first of all, it doesn't need this pattern.
Right.
This leg, on the other hand, needs it. We'll explore the other leg in a moment because we're probably going to do something different on that side, or we might just tweak it in a way where it gets us to a place where we want, and that is, can we have more efficiency in movement? The bottom line, and can we do it in such a way where you're triggering the proper like kinetic chain and kinematic sequencing? So
Yes.
I'm glad
Definitely.
you bring that up.
And the thing is, and that's what I tell everyone. I'm like, well, you have all the answers, so you don't need me. Like, I'm to the point where like I will not like, because I already know. Like, and if I don't know, you'll be able to see right away. I see the person change instantly, and then it turns into like
Instantly. Yeah.
instantly. And
Like just walk. You can see it in their
yes,
walk.
and
It's
their walk,
huge.
and I before and after videos are very important, because in that phase, like I said, working with the human mind, it's very biased and it wants to find fault in what you're saying because it's unknown. So I already know what the human behavior is coming as far as behind what their attitude is. And so I know, and I plan ahead of time, and I even say it, and they think I'm like this wizard that knows the future. And I'm like, no, I just have been doing this for a long time. And when you think about fascia, most of the time with kinematic chain and kinematic sequence, you think most of the time you're rotated one way. And so like I'll have people with SCMs on their right side, like me. And so they're like, oh, but they're obsessive in their head that they have to do the one side and the other side. And I'm like, that's not how it works. I go, inside, you've been torquing right for so long, for years. I'm like, your poor little left side needs a little, so I tell them and I explain it to them. I show them pictures. So it's a fine line between overwhelming someone and just meeting them where they are and educating them, because I also plant the seeds of, you're not going to need me for a long time. Because that's where, after the phase of I hate you, then they're like, wow, I feel great. Wow, everything's getting so much easier. And then they're like, but you're going out of town. What am I going to do? I'm like, you're not this little fragile daint anymore. I'm like, you're resilient. People have fallen down the stairs, they don't get hurt. Whereas if they turn their head before, they would get hurt. So I remind people that if I was having you come to me and you needed to come to me, I'm here. But I want you to need me for luxury because you're doing so well. You want to just keep going forward. Not that we're in the same place, just this loop of let's catch up where we were last time, So I really educate people on how their nervous system will also trigger that same pattern in every lifestyle situation that they're in. Think about how you're sitting in your car. You're usually slopping the same way, So how you sleep, you're going to slop. It feels comfortable to slop in your slop. So, it's your fascia tightening that way. So when you think about that, you sometimes you don't even need to work the one side. So, and then all the research I did when I was in NASCAR, is ambidextrous. You can be ambidextrous. It doesn't matter. You can grow your homunculus. I'm like, what a homunculus is.
I was just honestly, I just brought up the homunculus.
No one knows what
like
that is. I
2
don't
or
have
3 days
friends.
ago.
Yes.
Really?
I'm like, do you know what the homunculus is? People are like, what's wrong with you? I'm like, the
All
homunculus.
right. So for the listening audience,
You
it's a
can
human figurine where the places where the most densest nerve endings are in the body is exaggerated on the figurine. So it's a big head with giant lips and maybe a nose and ears are
So,
very
but
big.
it's basically the tissue in your brain. So there's a motor cortex and there's a sensory cortex. So this cortex is like a computer program. Say this disc is like this. That's the motor cortex. So say, because my teacher would be like, you feel more with your elbows than I can with my hands. He's like, so the representation of your arms in your sensory pattern of your brain is going to be a lot bigger, just like artists or musicians, because they're stimulating their nerves in their hands over and over and over. I'm touching people all day long. And so that stimulates. Even touching someone on the shoulder is so powerful because everything's energy. So as far as the sensory, as far as motor, you can grow whatever you're strong in, whatever you stabilize, whatever you stimulate, and that'll grow bigger in your brain. So you're more in control of those functions. So sky's the limit with that. You can be fast and you can get everything efficiently. Because think about that fascia. If it's locked down and slopping one way, that's circulation that you're lacking too. That's lymph flow that's stagnant. That's where I can make someone sick by loosening them, and then their system doesn't know what to do with it. Depends on how toxic they are. If they don't take a binder, and if they're really toxic, they'll be sick like the flu, because all that toxic garbage from our environment was in their tissue stored. And so I moved it around. And people are like, oh, I don't like that because I get sick. Well, that's living inside you. Like, get sick a little bit and then get it out. And then you get to the point where you no longer have tar and goo in your body. So then you become, again, more resilient. You get a cold, your body's like, da, 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 and then it's gone because you're able to handle it. We only have so much blood. If you're, you have inflammation here, you're tending to things here, this tendon strain, this is this, you have a headache, stimuli from relationships, you can't catch up. But if your body is efficient and in as many things as possible, you start working as a machine, as a system. I don't even work out that much anymore, but my movement's so efficient that I just stay very lean. And life is so much easier because you can eat what you want. You know, you're burning calories all day long. I'm dense, I'm solid, I'm heavy. I weigh a lot for a girl, but I look very small compared to what I weigh. We used to weigh me on the car scales in NASCAR. They're like, no way you weigh that. I'm like, yes, but I'm dense. You know, muscle is dense, and it's important to have muscle because then you're not frail. You're efficient.
Okay, so out of all the systems within the body, where's your hierarchy?
So I tell everyone, as far as not the systems, but where you should start. It's overwhelming for us, let alone I can't even imagine regular people. And then they
Right.
go to the doctors and they tell them, like, I have a lot of people right now where they're like, they just told me I need surgery. I'm on all these nerve pills and like 16-year-olds, young kids. I'm like, wow, it's crazy right now, just how stagnant we become with our interventions and, you know, just become a system. You know, we should all be staying on top of our research and making sure that's the best thing for that person at that time, you know. So as far as the hierarchy, I can't make recommendations on anything you do because I don't know what your system looks like right now. So I always recommend a genetic test. I work with the best in the world from Boulder, Colorado. Like, one of the guys that works a lot of my celebrities tests 5 genetics, mine tests millions. And so you look at what your body and where your map is right now. So, you know, I had a gene mutation where I started accumulating. I couldn't break down citric acid and folic acid, like processed folic acid and citric acid. So I would accumulate, it's not a histamine, homocysteine. And so I had this level of homocysteine that's also from the mold, that's common with the mold. And so I had this level of homocysteine. They're like, you could have a stroke at any minute. I'm like, what the hell? Screw it. I'm doing Normatec. I'm doing BML. I'm like, I'm over here and like thinking I'm doing well. And I'm about to have a stroke. I'm like, they're like, I've never seen this level off the charts like this. I'm like, great. Like, I'm doing freaking neurofeedback, putting the sensors all over my head. I'm trying to do whatever I can to better myself. So you see, if you don't know where you are right now, my
Yeah.
system was so aggravated that you can mutate genes and turn switches on. You can turn switches off. So that's how autoimmune is created. Your body's so inflamed and so like, hey, we're done, that things just start messing up and your genes present differently. So when you start to detoxify yourself and you see where you are, then I can take an enzyme that breaks down that homocysteine. So there, it's like, okay, let's start to balance myself where I am right now. Because anything else, you're adding more stuff to a shitty foundation, and you're just making things worse. Your system's already overwhelmed. So let's add this and sauna, cold plunge. I'm so cold. If like put me in the sun somewhere, I can do soft tissue work just by sitting there breathing in the sun. That is equivalent to like 7 cold plunges and 7 saunas just by breathing, because my nervous system is so ramped up that I don't need the extreme stimuli right now. Again, time and place, tools are there for a reason. So you don't just go jump into a tool because everyone else is doing it, you know. And you see all these things with like cold plunge is bad now. Look at what they tested. They tested sprinters, cyclists. They put them in the cold plunge and then said, go ride your bike as fast as you can. Didn't help. It's not good. It messed with strength. So their power output was diminished. So then they're like, oh, it ruins your power. So, and then again, if you're going to do strength workouts, it shows that the strength gains are not as efficient as if you were to do it on a different day with a cold plunge. So maybe switch your days. It's not a blanket bad or good. There's toolboxes for every situation. And the more
This
you
is a
understand it, the better.
perfect segue when you say tools, because
Oh, I love it.
you gave me your little tool here. And for those that aren't watching the video component of the podcast and just listening in, I'm holding in my hands this cork dome that's
Mhm.
about twice or three times the size of a normal like cork that you'd find in a wine bottle or something, but it's smooth on the top, very flat, nice wide base. Um, my clients love your tool, the Dr. Jena little cork dome. What's the actual official name of this product you have?
The body block.
The body block. I don't normally, throw products up here on the podcast or anything, or try and endorse a whole bunch of things, but this is going to be completely an aberration then, because this body block is it's simple yet brilliant. I mean, they can mobilize a whole bunch, especially around the feet, of course, but
Yep.
it's not limited to the feet. How give me a little bit of breakdown on this and what you use it for and all that.
So in that independent phase where I'm trying to transition people from only, relying on me for every answer to their question, I start to give them tools for at home. And then I start to ask them, they're like, oh, this happened. What do I do? I'm like, I don't know. What do you do? And then they're like, oh, I could put ice. But then that doesn't help because after 20 minutes, you get more swelling. So then, so you see them go through their checklist and understand their tools. But that's something where you could bring that with you. And it's so easy. And I tell everyone because they get connected to me, like, oh, I need you because I'm like elbowing them all day. So I'm like, that's my elbow in your pocket. Like, go take it with you, put it in your purse. So, like, there's like a safety, everything's human psychology. There's like a safety net to this, like a little banky where they feel safe, like, oh, wow, this is Dr. Jena here with me. And that's how I transition people away from not only relying on me, but, having them gain their own autonomy toward their own health. So it's a beautiful thing because it's fearful in the beginning to have an injury. And you go to these specialists that tell you, well, I don't know what to tell you. I have people pay millions to the Mayo Clinic and they can't find help. And you think something's wrong with you. And so I get this time and time again where I'm like, no, this is, I just kind of guide you back on track and then give you the tools that you need to keep yourself healthy for the rest of your life. These are tools. And so this was something where with the nervous system, especially in the beginning, the flat part of it, because, I used to use lacrosse balls back in the day before anyone was using lacrosse balls, and it would roll off of it. And subconsciously, it freaking hurts when there's a trigger point on a spot that's tender, on fascia that's not circulated. It hurts. And then you muscle guard. So when you muscle guard, you're not doing anything. You're creating a fortress and, restricting the oxygen to the area even more. So it's all about breathing under the stimuli. So if you're not breathing, it's not going to let go. So with a ball, as soon as the fascia is tense or tender, it'll roll off of it because it's taut. The tissue, it feels like a leather belt. So I always found that the ball would just reinforce the same stuff they're already doing. And they're over here, I rolled on the ball for 20 minutes. Again, just like the stabilization stuff, you shouldn't be rolling on balls the rest of your life to live. You efficiently need to stimulate the tissue to reset the nervous system, to gain those degrees of motion back, and then condition them with motor control and different stimuli in a safe environment, because your body's always going to revert back to what it knows if it's too much of a stimuli. And then you work out of that to where you can't get hurt and you can work yourself in any point. So this is something where when it's static, you can really let the fascia just sit, and then you can move the extremity. So I call it the pin and stretch, where you actually let it pin, and then you take the tissue through full range of motion with that stretch or that thing pinned. And it's painful. My place out in California is called House of Pain because, like, it's ego pain. I'm hurting your pain. I cause you pain. I fix your pain. Lots of pains, but it hurts. And I say it's such a stimuli that's so harsh, but it's so short that you're able to tolerate it, and it resets your nociceptors. So your body's perception of pain, basically, it gives you a different threshold of pain. So it's basically you're resetting the nervous system. So this is one of the tools that I found, especially for the foot and for travel. You can't take a foam roller with you everywhere. And I try not to make things stressors for people. I don't want it to be another thing you're failing at. They're like, oh, I was going to do your exercises. I should have done them more. I'm like, you do them one time. You shouldn't have to do them the rest of your life. Just one time. Stop telling me about it, about how you didn't do it. Just one time, just do it. And so again, a lot of it's the bias and just getting people out of their own way, but also showing them their wins, because in their head, it's all failures. When you're hurt, you have so much going on in your life. They don't know this, so they feel vulnerable. So I'm like, look at how far you've come. I show them videos, give them tools like this. They're like, hey, I used it. I felt better. It's like a little kid, like, wow, great. You teach them. And then I say they're my little baby bird that goes on their way. So, but the thing I know I'm rambling about a bunch of stuff, but I want to touch on the hierarchy of different things, like you said, and where to insert these different tools. So first I do the blood work, the genetic testing. I see where your genetics are, and I see what you're dealing with at the moment. I look at your allergies. You can reset allergies. So say you're allergic to something, not something like anaphylaxis, like peanut allergy. Again, you can de-intensify that, where you're making it a little less intense. But I haven't tapped into that because there's risk versus reward. I'm not going to be like, hey, let's see if you're going to die or not with your closed throat. So, but with regular allergies where, I've had to have EpiPens because I've had too many stimuli at once as far as allergies. Because when your system's overloaded with inflammation, this cheese or dairy is going to inflame you way more than it would have if you were clean and your lymphatic system was not toxic, like we were speaking of earlier. So I look at what you're allergic at or allergic to. You take away those allergies for 3 months, and you can reset your system where they no longer show inflammation when you introduce them to the system again. So it's just a way to kind of like give yourself a break. Your body is inflaming you because it's saying, hey, stop eating this, you do it too much, or there's something in there that it can't handle or it's having too much of. So that's where you reset your allergies. After that, then we look at your movement, we look at supplements, what your lifestyle is, where you're not getting nutrients, where you're lacking, what you can do better, and how to implement these tools in your day to day so that you can do, I call them 2-for-1s. You don't want to have to work so hard to recover and live. You just kind of, I have people put foam rollers by their beds. They're doing stuff by their, it's just convenient. You make it easy for yourself to just grab this while you're on the phone. You don't want to make it a whole other episode to where you're going to not do it and fail. You just make it part of your life, and you'll see it gets easier and easier, and then you don't have to do it as much, if at all.
Sweet. I love it.
It's the best.
Well, it's just, I guess, last question with that. How heavy is your client load? Like, do you cap it off at a certain number or anything like that?
So I'm 100% Greek. So I'm in the mentality of just work until you die, basically. Can't work enough. So I had to work with my own biases on that, because I was like, wow, I work with a lot of CEOs. I see how they step back from their business and they delegate. I'm like, I can't do this anymore. I was working 12-hour days. I would work with families for 6 hours and then work full time outside of that, so I wasn't just stuck to one family. Because like it's crazy out here. You got to like keep yourself protected and make sure that I don't ever put my eggs in one basket, because I don't let people control my motives of what I'm doing and why I'm doing it, and impact my character or integrity. So it's I'm like lost my train of thought with that.
No,
Oh,
but
the
just
caseload. So it
yeah.
was like 12-hour days, 12 to 14-hour days. I'm not kidding you. 7 days a week for since I've been out here about 7 years, and it was at least 5 years, 5, 6 years. And I just got to the point where I was like, I can't burn out. I went to med school. I'm the only one in the class with a job. I'm flying all over the place. I'm going to the Perform Better conventions. Everyone else is just scared to fail and get a C. And I'm like living a whole life outside of school. And I didn't think burnout was real. And I got to the point where like a phone call felt like it was 7,000 bricks on my heart. And then people are like, you think you're too good now? I don't want to be your friend anymore. And I'm just like, oh my God. Like, it got to the point where I was like, because people perceive based on their insecurities. And it's like, it was crazy because people act like you're supposed to have everything figured out just because you seem strong in certain things. But it's like, you always have to remember people go through things at different times, and it's not always what you see on the surface. So yeah, it's been an interesting journey, but I cut back a lot. I started doing things that make me passionate again, do the podcast interviewing specialists, and I love it. Doing interviews, traveling with Perform Better, traveling all over the place, and getting back to my life of being outside more. So I'm trying to work away. My protocols are being taught to where I can still help people and not have to be the workhorse, because I'm more valuable not working.
That's good.
In that
That's
sense.
really good.
Yeah.
So, okay, we're up against the clock. If people want more information about Dr. Jena Gatses, like your website, follow you on Instagram, what's the best way?
So drjena.com, you find the genetic testing. You can find me on Instagram, Dr. Jena Gatses. Reach out. I'm always open to sharing information and to like-minded individuals that want to better others, and just keep it open as far as discussion to how we can all evolve, because there's so many things that are out there that we don't even know yet. And I like tapping into stuff and just better in the
That's
world.
exciting.
So charities,
Yeah.
anything. Let's all hang out, get involved, and contact me if you're interested in different things like that. I do beach cleanups, all that kind of stuff. So
Sweet. Oh, yeah. Like I say, you're a sister from another mister for sure. This has been great, Jena. Thank you so much.
And like you said, our conversation sparked so much, and same, like I always see these things on social media where it says like, tell your friends when you feel like you heal when you're around them, like that's that intuition you were talking about, where it's real and you have that care and you come from a place of love. So you make people feel safe and they're able to be themselves more. And that's a beautiful thing. So I appreciate this. I appreciate our talks always, your education behind everything you're doing and just your passion behind it and how many people you've helped. So I just feel like we're all on this big bandwagon of people that want to, put good into the world, because there's so much going the other way and we have to all stick together.
Thanks, great. Next time I'm in the LA area for a little surf session, I'll make sure I give you a call so we can do the beach cleanup together.
Let's do it. I'm in, always.
Man, time always flies by when I'm talking to Jena. I just want to thank her for coming on, and be sure to meet her in Long Beach, middle of July, like the 16th, 17th, and 18th for the Perform Better Functional Summit, performbetter.com. Register today. And while you're at it, register for my workshop on the East Coast in West Warwick Island, September 27th, Recalibrating Movement from the Ground Up. And be sure, hey, seeing you're on the move, you might as well head to Kansas City, middle of July. If you can't make it to Long Beach and you're in the Midwest, meet me at the NSC National Conference. Just go to nsca.com, register today, and I'll see you there. And be sure to check out my website, rockysnyder.com. We've got a whole bunch of cool stuff there for continuing education, blogs, and podcasts. Another shout out to Setanta College. Just go to setantacollege.com to find out what they have to offer. Pick up my book, Return to Center, and we'll see you next week.